सर क्या अलग अलग इसका है क्या यूट्यूब पे? हेलो सर, ये मतलब मैं जब यूट्यूब का लिंक खोल रहा हूँ तो ये यूट्यूब के लिंक पे तो वो मैडम वाला ही चल रहा है अभी तक तो। अच्छा, आ जाएगा किस समय? नहीं, वो लिंक चेंज है क्या? हाँ
करवा देंगे।
अच्छा। हम्म हम्म। So hello friends. So now we are starting a very important session, forensic medicine. How was your paper? पेपर कैसा था बेटा? फोरेंसिक वाला दैट वाज वेरी इजी. फोरेंसिक वाला दैट वाज वेरी इजी आई थिंक. यस. गुड. चलो अच्छा था ना. Good. Forensic was very easy. According to me, the forensic is very easy because most of the question are directly from notes. Okay. So we can start with one by one. Okay. These are recall based questions. Okay, dear. Okay. Now the first question, very simple question. Which is not a grievous hurt? Which is not a grievous hurt? Very simple question. Number one, emasculation is a grievous hurt. Fracture of femur is a grievous hurt. Permanent privation of hearing is a grievous hurt. Yes. But if you are admitted in hospital for 1 week or 7 days, it's not a grievous hurt. Yes. So this is not a grievous hurt. This I discussed in PrepLadder notes. If you can see, these are the notes. This is emasculation. Number one. Yes, I discussed everything. Number two, permanent privation of, as you can see, permanent privation of sight of either eye. Privation of hearing. Yes. Yes, very simple. Now privation of any member or any joint. Yes, dear. Very good, sir. सबका आंसर सही है. Destruction or impairment of any power. Destruction of impairment of any power. Permanent disfiguration of head and face. Yes. Very good. 1 week of hospital admission in yellow area. That is also good. Not a problem. Okay. Yellow area. Okay. Fracture and dislocation of bone and tooth. Yes. And the last is any hurt which endangers the life, which causes severe bodily pain for 20 days or more, and you are not able to follow ordinary pursuit of life for 20 days or more, it will be a grievous hurt. So here, if you can see, it is given 7 days. It is given 7 days. So that is 1 week. That's why it is the 1 week hospital admission is not a grievous hurt. Okay, done, sir? चलो आगे. सिंपल क्वेश्चन था, है ना. ये सारा एक्सप्लेन किया हुआ है प्रेपलेडर वाले नोट्स में, सारा ग्रीवियस सेट के सारे क्लोजेस. ठीक है. चलो. Which is not used as a chelating agent in heavy metal poisoning? Yellow doesn't mean here. Actually, yellow doesn't mean in here. Here you have to remember hospitalization for severe bodily injury for 20 days or not able to follow routine activity for 20 days or more. है ना. यहाँ येलो एरिया का मीनिंग नहीं है. So now tell me, which is not used as a chelating agent? Anyone? Very simple. Which is not used as a chelating agent? Anyone? Ball, EDTA, penicillamine, oxime. Tell me, dear. Yes, anyone? Very simple question. Which is not a chelating agent? बताओ बेटा. Yes, which is not a chelating agent? Ball is a chelating agent. EDTA is a chelating agent. Penicillamine is a chelating agent. कौन सा chelating agent नहीं है? It is, yes, oxime. Oxime is used in organophosphate poisoning. Yes, my dear friend. Very simple, sir. You can see this. I also discussed in the notes. This is the whole history of the BAL, British anti-leucide. सारी चीजें दी हुई है, which is also known as dimercaprol, which is also known as dimercaprol. Okay, done. BAL. Second, this is EDTA. This is DMSA, and this is penicillamine. All indications are given. All indications are given. What is not a chelating agent? Oxime is not a chelating agent. Very simple question. है ना, oxime is not a chelating agent. But according to me, like out of 11 to 12 question of the forensic medicine, you should clear at least 11 or 10 questions. है ना, सारे नोट्स में से आए. ठीक है बेटा. So oxime is used for organophosphate. It is not a chelating agent. है ना, डन. चलो आगे चलते हैं. Sir, it's very simple question. इससे related question कई बार आया. Blackening around the gunshot entry wound is seen due to. Blackening around the gunshot entry wound seen due to number 1 smoke particle, number 2 unburned gunpowder, number 3 muzzle of the firearm, number 4 fire effect. Anyone blackening. बताओ बेटा, blackening जो एंट्री वुंड के चारों तरफ blackening होती है, that is due to smoke particle, unburned gunpowder, muzzle of the firearm और fire effect. Tell me dear. Anyone? A, B, C, D. Give me the answer. बताओ. ये भी बहुत easy question है. Very easy. बताओ. बोलो. Smoke particle, unburned gunpowder, muzzle or firearm. Blackening surrounding the entry wound. Tell me dear. What is your answer? It is smoke, unburned gunpowder, muzzle or fire effect. Tell me dear. It is A, smoke particle. चलो इसको थोड़ा डिटेल में डिस्कस कर लेते हैं. We can see this I discussed. Flame or fire produces burning of hair. Yes. Which is known as singeing. This has also been discussed. Okay. Smoke produces blackening. Smoke produces blackening, and unburned gunpowder produces tattooing. This I discussed in detail in PrepLadder notes. Very simple, sir. This I discussed. So it is smoke. It is smoke produces blackening. क्योंकि smoke को क्या बोलते हैं बेटा? धुआं. So धुआं is a black color, it's produce blackening. So fire or flame produces burning. Can you hear me? Now audible? Now audible? Anyone? बता दो बेटा. Okay. Now it is audible. तो कौन सा क्वेश्चन अब वापस कौन सा ब्लैकनिंग वाला समझ में आ गया? यू गॉट द ब्लैकनिंग क्वेश्चन? यस. यहां तक चिलेटिंग एजेंट डन. कौन से क्वेश्चन पे आ जाओ? ब्लैकनिंग पे आ जाओ. ओके. सो चिलेटिंग एजेंट, ऑक्साइम इज नॉट ए चिलेटिंग एजेंट, है ना. ये तो हो गया ना. ऑक्साइम इज, चलो यहां से स्टार्ट कर देते हैं. विच इज नॉट ए चिलेटिंग एजेंट. बाल इज ए चिलेटिंग एजेंट, ईडीटी इज चिलेटिंग एजेंट, पेनिसिलामिन इज ए चिलेटिंग एजेंट, ऑक्साइम इज यूज्ड इन ऑर्गेनोफॉस्फेट, है ना. अच्छा, ड्राउनिंग पे आ जाते हैं. ठीक. नाउ ब्लैकनिंग इज बिकॉज ऑफ स्मोक, ये भी हो गया. नाउ दैट इज ए केस ऑफ ड्राई ड्राउनिंग. व्हाट इज द कॉज ऑफ डेथ इन ड्राई ड्राउनिंग? ओके, डन सर. व्हाट इज द कॉज ऑफ डेथ इन ड्राई ड्राउनिंग? कॉज ऑफ डेथ इन ड्राई ड्राउनिंग इज लैरिंगोस्पाज्म, है ना. इट इज ऑल्सो, मेरे सारे क्वेश्चन नोट्स में से आएंगे. ऑल द क्वेश्चन आर डायरेक्टली फ्रॉम नोट्स. द ड्राई ड्राउनिंग कॉज ऑफ डेथ इज लैरिंगोस्पाज्म. कैन यू सी द नोट्स? यस, वेरी सिंपल. यस, दिस इज वेट ड्राउनिंग. इन वेट ड्राउनिंग there is a electrolytic imbalance. In wet drowning there is a electrolytic imbalance जो मैंने एकदम डिस्कस किया है. Yes. Then in dry drowning the cause of death is laryngospasm. In dry drowning the cause of death is laryngospasm. And in hydrofusion the cause of death is reflex vagal inhibition leading cardiac arrest. In hydrofusion, cold water drowning, it is reflex vagal inhibition leading cardiac arrest. It is leading cardiac arrest. So सारे क्वेश्चन को बहुत अच्छी तरीके से एक्सप्लेन किया हुआ नोट्स में. So you cannot miss. आपके सारे क्वेश्चन नोट्स में से आए. अच्छा, there is no edema of the lungs, doesn't matter. There is no water in the lungs. That's why the cause of death is no water in the lungs. That's why cause of death is laryngospasm. It's a dry drowning. Yes, very good. चलो, next question. Sir, ये question था that 13-year-old girl with mother came to the hospital in emergency with pain abdomen and UPT test was positive. Yes, there was no edema of the lungs. That means there is no water in the lungs. Okay, and that is UPT means pregnancy test is positive. First step as a medical officer. First step as a medical officer, my dear friend, this is actually a medical legal case. And in any medical legal case, why it's a medical legal case? Why it's a medical legal case? Yes, it is a medical legal case because the 13-year-old girl is pregnant. 13-year-old girl is pregnant, so it's a kind of a rape case. Okay, so whenever medical legal case comes to you, मैंने ये यहाँ पे explain भी किया. Duty of a doctor in medical legal case. Duty of a doctor in medical legal case is police information 39 CRPC. Yes, she is a minor. Police information 39 CRPC. Any medical legal case यहाँ लिखा हुआ है देखो बहुत easily. Any medical legal case or postmortem case according to POXO Act. Yes, my dear friend. It comes under POXO Act, protection of child against sexual offense. So that has to be informed. That has to be informed. So without any doubt, the first duty is to inform the police. Yes, first duty is to inform the police. Yes, very good. बहुत अच्छा. First duty is to inform the police. Actually, after 12 years of age, female can give the consent for medical examination. What is the age limit for giving consent for medical examination? 12 years. Now tell me one more question. What is the age limit for giving consent for surgery? Anyone? What is the age limit for giving consent for surgery? सर्जरी के लिए कंसेंट देने की एज लिमिट क्या है? एनीवन? बोलो बेटा. फिजिकल एग्जामिनेशन यू कैन गिव द कंसेंट आफ्टर 12. What about the age limit of giving consent for surgery? It is yes 18. Very good, sir. So this is first to inform the police because it's a medico legal case. Chalo, sir. Now the next, it's a very simple question, sir. It's a very simple question. Match the poison and the site of action. अब देखो दोस्तों, इस poison को देखो. Datura act on CNS. I will tell you where I taught you in the PrepLadder notes. Nicotine is a cardiac poison. Known as a queen. मैंने पढ़ाया था. It's a serious poison. Nitric acid act on the skin and Nux vomica act on the spine or spinal cord, strychnine. So you can see A2, B1, C3, D4. Yes, very simple explanation. This is the right answer. Okay, अब आपको पढ़ाया कहां पे था देख लो यहां पे भी. Yes, I taught you this here. Sir, Datura is a delirium poison. That's why it act on the CNS. Yes, it act on the CNS. Delirium poison. Now, spinal cord poison, I told you Nux vomica. This I discussed here. Every question was from notes. Strychnine, Nux vomica. Cardiac poison, known as a queen or dona queen. Very simple. Yes, Nicotina tabacum. It's a cardiac poison. Okay, every line is from notes. Hai na? Nitric acid, I told you nitric acid acts on the skin. ये भी directly notes में से था. So, doctor साहब, this is very very important discussion which I discussed in the all PrepLadder classes. है ना? बहुत easy question था. चलो आगे चलते. Now cadaveric spasm is seen in. ये थोड़ा tricky question था. This was little bit tricky question. First of all, I will tell you cadaveric spasm is seen in violent death. It is seen in violent death. It is seen in gunshot injury, yes or no? Yes. It is seen in electrocution because electrocution is also an example of violent death. Electrocution is also an example of violent death. Yes, this recall will help in all exam because ये सब वापस बार-बार repeat question पूछे जाते हैं. This cadaveric spasm is also seen in drowning. Yes, my dear friend. And cadaveric spasm is not seen in traumatic asphyxia because traumatic asphyxia is not a violent death. Traumatic asphyxia is what? Because of the trauma, your chest is fixed. Because of trauma, your chest is fixed. This is cadaveric spasm. So cadaveric spasm is seen in all violent death. I will tell you where I discuss in PrepLadder notes. This is cadaveric spasm in drowning. Yes, my dear friend. Now, as you can see, dekhna, this is very, very important. I told you the trick. A, B, C, D, E. But sir, A for asphyxial death, that is a drowning death, not in like traumatic asphyxia. So A, asphyxial death, B, brain injury, C, cerebral injury, D, drowning, E, excitement, F, fear or firearm injury. Gunshot injury is a firearm. Done. Electrocution is also a violent death. If you see, Electrocution is also a violent death. So doctor, it is seen in all except it is not seen in traumatic asphyxia. What is the reason it is not seen in traumatic asphyxia? But traumatic asphyxia is not a violent death. है ना? मैंने इसकी ट्रिक भी बना दी थी A, B, C, D, E. A, asphyxial death like drowning, it is seen when you struggle. Your hand has a cadaveric spasm. है ना? But it is not seen in traumatic asphyxia because traumatic asphyxia is not a violent death. Okay? तो सर इसका जवाब हो गया traumatic asphyxia, it is not seen. Is it clear, sir? चलो. This I discussed in the main classes. सारी चीज डिस्कस हुई है. Sir, a patient with constricted pupil, pinpoint pupil. Yeah, so this is very simple. What is there? In gunshot injury, I told you in gunshot injury, it is seen, my dear friend. In gunshot injury, suicide, doctor, if I commit suicide, the hand remain as it is. It is seen. Cadaveric spasm is seen in gunshot injury. Yes. It's a constricted pinpoint pupil. Without any doubt, it's a opioid poisoning. Without any doubt, it's a opioid poisoning. बहुत easy है. अब इससे ज्यादा आप क्या लोगे यार? हैं? कह रहा हूं ना सर, ये देख लो. There is a stage, three stages of opium: stage of excitement, stage of stupor, stage of coma. Yes, and there can be pinpoint pupil. This I discussed. Pinpoint pupil is seen in opium poisoning. It is seen in opium poisoning. चलो सर, which injury is not seen? Which injury is not seen in a case of road traffic accident? Doctor, I am telling you, road traffic accident will produce injury which is just like a blunt weapon. No, sir, in electrocution, there will not be rhabdomyolysis due to shock. The electrocution rhabdomyolysis is a different thing. That causes kidney failure. That causes shock. But here I am talking about in electrocution, you have, like, I'm giving example. आपने क्या किया? You just caught a wire. Just जैसे wire पड़ा, that will produce this cadaveric spasm. Okay? Yes. So now this is very simple question. In road traffic accident, that is a blunt trauma. What injury are produced? Yes, as you can see, by blunt trauma, there can be injury, which I discussed here. As you can see, abrasion, contusion, laceration, fracture, dislocation. Yes. Almost same question were there. Actually, there was a question like there was a history of the road traffic accident. Which injury is not possible by road traffic accident? Okay. So by blunt force, these injuries are possible. Abrasion, contusion, laceration, fracture, dislocation. If you see, these injuries are produced by sharp force. Incision, stab or chop. These are produced by sharp force. So automatically if you see, very simple, sir. Automatically if you see which is not produced by road traffic accident, the answer is chop wound. Contusion, abrasion and laceration, these are produced by blunt force. Very simple explanation. Contusion, abrasion and laceration, these can be produced in road traffic accident. So here answer is chop wound because it is produced by sharp edge weapon. चलो अगला चलते हैं. Sir, a history of burn patient, their whole anterior chest, whole anterior abdomen and right upper limb, whole right upper limb and full right thigh was involved. Full right thigh was involved. अब देखो दोस्तों, for it's a rule of 9, Wallace rule. Whole anterior chest 9%, whole abdomen, anterior part of the abdomen. Whole abdomen means anterior part of the abdomen. It is 9%, and right upper limb. It is whole anterior chest and anterior abdomen. It is whole anterior chest or anterior abdomen. Tell me dear, one thing. It was anterior part of the abdomen or whole abdomen? Tell me dear, anyone. It was anterior part of the abdomen or whole abdomen? Anyone? Give me the answer. Because anterior chest is 9%. Whole abdomen or anterior part of the abdomen? Whole abdomen or anterior part of the abdomen? Anterior only. If it is anterior only, it is 9%. Okay. Then right upper limb, it is 9%. Right upper limb, it's a 9%. If it is anterior part of the abdomen, anterior chest 9%, anterior part of the abdomen 9%, right upper limb 9%, and full right thigh, it is also 9%. Full right thigh, it is also 9%. Here I discussed here, if you see, this is rule of 9. You can see head and neck 9, upper limb 9 and 9, right 9, left 9, chest anterior and posterior 9 and 9, abdomen anterior and posterior 9 and 9, yes, and lower limb, it is 9 plus 9 for right and 9 plus 9 for left. Now, I discussed here that in thigh, if you see here, in thigh, yes, in thigh, it is 4.5%. 4.5% anteriorly, 4.5% posteriorly. So you can see 4.5 and 4.5, it is 9%. 4.5 and 4.5, it is 9%. Okay, so that is for thigh. Okay, अब देख लो. So if it is the complete thigh, if it is right upper limb, if it is anterior part of the abdomen, if it is anterior part of the chest, and if you see, my dear friend, it is 9 plus 9 plus 9 plus 9. So that will be 36. That will be 36. Is it clear, sir? Is it clear? Very, very important answer. And yes or no, my dear friend? This is very, very important, sir. Okay. So if it is 9 anterior chest, 9 anterior abdomen, right upper limb, and the full thigh cover almost 9 to 10%. It is clear? Chalo, theek hai, chalo. Now, sir, this is a very important MCQ. All are used in the identification of corpse. Corpse means dead body, which is not used in the corpse. Corpse are identified by DNA. Dead body. Corpse is a dead body. Explain वापस करता हूं बेटा. Wait. चलो explain एक बार वापस कर लेता हूं. Anterior chest 9%. Anterior part of the abdomen 9%. Right upper limb 9. Left upper limb 9. So here right upper limb is given, it's 9%. Full right thigh. Full right thigh. The complete right thigh is almost 9 to 10%. So it will be 9 plus 9 plus 9 plus 9. It will be 36. Very good, sir. Now, sir, which is not used as an identification method, sir? Why muscle? Muscle क्यों होगा बेटा? Sir, देखो. Anything which is having DNA, that is used for, it's a common sense question, sir. It's a, hello everyone. It's a common sense question. DNA is analyzed by everything. Number one, teeth, yes. Blood, yes. Muscle, yes. Nails are not used to analyze DNA. Nails, because nail is a dead material. It is not used for analyzing DNA. Yes, the nail is the right answer. It is not used in analyzing DNA. So I would say it is not used for identification. It is not used for identification. Yes, very good. Common sense का सवाल था. Sir, this was a question. Actually, this is a question of history. I don't know like why they have put this question. British India Company smuggled which drug from India to China in 18th century? Actually, sir, this was the only question which was, I would say, that is not like the question for the FMT. This is the question of the I would say that it's a question of history. Right? Yes. You skip this question. Yes, without any doubt. Here answer is opium, afim. Those people, they used to analyze that used to smuggle that afim from India to China in 18th century. Yes, not related to MBBS. It is related to something else, huh? Some other exam. The option was magic mushroom, but it doesn't matter. It's a magic mushroom or other mushroom. It was that same. Okay. Now you can remember like afim was very commonly, because afim comes in the NDPS Act. So it is very, very commonly used. So my dear friend, this is all about INI-CET. Like there are almost 11 to 12 MCQ. I discussed almost 12 MCQ. But more option was tobacco, but tobacco was not used for smuggling, my dear friend. Tobacco is not used. Age for consent, my dear friend. If you want to go for physical examination, you can give consent after 12. But age for any other surgery, the consent age limit is above 80. चलो सर ये बता दो मेरे को. How many question did you make the right option, right correct? आपके कितने question सही हुए? अच्छा, exact UPT was not mentioned, doesn't matter. But if the pregnancy test was mentioned, that is okay. Okay. Now tell me, कितने question सही हुए? ये बता दो मेरे को. बोलो बेटा. 10. हर्ष चेलानी 10. बहुत बढ़िया. और बोलो हरीश चेलानी 10. और बताओ. अच्छा, you are here for FMG, doesn't matter, but आपको भी the confidence level is okay. रोहित 10. श्री कृष्णा thoughts 9. Okay, very good. चलो. Okay, one skipped. Okay, very good. Chalo. Only Poxo one wrong. The gunshot is having blackening because of the smoke. Dear. 2 wrong. Very good. आप सबके लिए तालियां. जामद सर से. Smuggling वाला. Okay. उसको skip किया. Doesn't matter. So anyways, sir, this is all about a very, very important session. So ना, for NC is like most of the question directly come from the notes ना. तो आप क्या करो? एक बार नोट्स को रिवाइज करो. हाँ, क्वेश्चन वर वेरी इजी. अकॉर्डिंग टू मी इट वाज अ वेरी इजी टू मॉडरेट पेपर फॉर फोरेंसिक मेडिसिन. Sir, for sexual offense is 18-year consent. No, again I am telling you, For physical examination, your age limit is about 12, you can give consent for physical examination, है ना? But automatically, if you remember, like the if the child is below 18, it comes under the POXO Act. Okay, so we'll inform the police in that case. Consent for physical examination you can give about 12. चलो ठीक है. So this is all about for forensic medicine, dear. और आराम से आगे की तैयारी करना. आपका जैसा भी पेपर हुआ हो, डजेंट मैटर. यू स्टार्ट योर प्रिपरेशन. एंड अगर आपका बहुत अच्छा पेपर हो, वेट फॉर द रिजल्ट और गुड लक फॉर योर एग्जाम्स. आप हमेशा सारे एग्जाम्स क्लियर करो. ठीक है? ओके. चलो अपना ध्यान रखना. बेस्ट विशेस. अपना ध्यान रखना.